Good afternoon, and thank you very much for tuning in to Parliament Television today, 24th February 2024. And business of the House, as usual, will start at 14:30 hours like most Tuesdays. And we'll be able to bring you live proceedings of the House from Parliament Studios. And to be with you, my name is Pauline Monga.
And my name is Mutali Lesmate. Good afternoon to everyone watching Parliament TV. We're joined by our colleagues, the sign language interpreters, Jason Manda, and later to be joined, of course, by Chola Kaoma. So just before we give you an outlook of the business that the House is expected to consider today, we'll take a look at business that was considered on the floor of the House on Friday, 20th February 2026. We hope that you'll be with us and follow deliberations as we bring them live on Parliament TV.
Yes, business of the House on Friday 2026 started at 09 hours, and at 09:45 business of the House was suspended, and this was to enable the Honourable Madam Speaker to meet the President as he was arriving at Parliament buildings to address the nation on the progress made in the application of national values and principles.
That said, so at about 09:45 hours, His Excellency the President of the Republic of Zambia, Mr. Hakainde Hichilema, addressed the House on the progress made in the application of national values and principles. And
thereafter, it was resolved that as it is rising on that particular day, the House adjourns until Tuesday, 24th February 2025. And this was to enable the honourable members of Parliament to go and dissect, actually, the presidential speech in readiness for their debate today, which is starting today. And it was then the House then thereafter adjourned accordingly at 11:27 hours. So that was business on Friday, 20th February 2026. And just now we shift our attention and look at the business that is expected to be discussed on the floor of the House today, Tuesday, 24th February 2026.
Okay, so we expect to have announcements if there'll be any, urgent matters without notice if there'll be any, a ministerial statement to be moved by the Acting Minister of Health, questions for or answer, understanding order number 80, and a motion. So the ministerial statement that will be presented on the floor of the House by the Acting Minister of Health is on health issues of public concern. So this is the ministerial statement we expect the Acting Minister of Health to deliver on the floor of the House today.
And we have 8 questions that earlier mentioned in total, understanding order number 80. And one of the questions is coming from Chinsali Member of Parliament, Mr. Kalalwe Mukosa. And his question is directed to the Minister of Water Development and Sanitation. And part A of the question, he would like to know whether the government has any plans to construct sewer systems in the following areas in Chinsali district. And these are Muliangolo, Kabuta, Seed Farm, and Chandamali. And in part B, he wants to find out if so, when the plans will be implemented, and part C, if there are no such plans, why.
Kabushi Member of Parliament, Mr. Kanengo, will pose the second question on the floor of the House today, and this is question 210. His question will be directed at the Minister of Local Government and Rural Development. A question he poses in 3 parts, and in the first part, he wants to know whether the government has any plans to help farmers in Kabushi Parliamentary Constituency who got loans under the Constituency Development Fund in 2023 to purchase farming inputs but were affected by the drought of 2023-2024 farming season. If there are no plans, if so, when the plans will be implemented, and if there are no such plans, the member wants to find out why.
And we have another question coming from Chinsali Member of Parliament, Mr. Kalalwe Mukosa, directing his question to the Minister of Agriculture. And the first part of the question, he wants to know the staff establishment for the agricultural extension offices in Chinsali district as of October 2025, and how many officers there were as of October 2025, and part C, whether the number of officers above was adequate to ensure optimal performance, and part D, if not, when the additional officers will be deployed to Chinsali district.
And the fourth question of the day will be posed again by Chinsali Member of Parliament. This time around, his question goes to the Minister of Defence, and he wants to know how many categories of military officers there were in Chinsali district as of 2025. These categories include Zambia Army, Zambia Air Force, and Zambia National Service. In his question, he further wants to know whether the government has any plans to construct houses for officers in the Zambia Army, in the Zambia Air Force, and the Zambia National Service. The third part of his question, he wants to know, if so, when the plans will be implemented, and lastly, if there are no such plans, he wants to know why.
And question number 213 is coming from Chiluvi Member of Parliament, Mr. Mlenga Fube, directing his question to the Minister of Fisheries and Livestock. And part A of the question, he wants to know whether government has any plans to restock livestock in Chiluvi district. And part B of the question, if so, when the plans will be implemented. Part C, how many of the following areas will be how many of the following will be restocked in the Chiluvi district? And these are chickens, goats, and fish. And part D of the question, what the estimated cost of the project is. And part E, if there are no such plans, why?
And then the sixth question that will be posed at the floor of the House again will come from Chinsali Member of Parliament, Mr. Kalalo Mukosia. This time around, the question goes to the Minister of Agriculture. He wants to know what mode of transport is provided to camp officers for use in executing their work in Chinsali district. He also wants to know whether all the camp officers were capacitated with transport to execute their duties as of August 2025. And lastly, if not, what interim measures the government has taken to ensure that camp officers have transport to support their work.
And the question number 215 is coming from Mr. Francis Kapyanga, Member of Parliament for Mpika Central, and he wants to find out from the Minister of Technology and Science. Part A of the question, he wants to know whether government has any plans to construct 5G communication towers in the following areas in Mpika parliamentary constituency. And these are Luchenene, Katibunga, Mukungule, Kaluva, Kalimba, Nabwalia, Changalilo, Kashaita, and Mateve. And part B, if so, when the plans will be implemented. Part C, what the total estimated cost of the project is. And part D, if there are no such plans, why?
So those are just some of the questions that we expect the House to consider today. But after the questions, we do expect a motion to be moved by Chikankata Member of Parliament, Ms. Jacqueline Sabao. And this is the motion, thanks the President's address, that the thanks of this Assembly be recorded for the exposition of public policy contained in the President's address. And it will be seconded by Mr. Elias Daka. So this time around, we'll soon take you to the House, where we expect the Speaker's procession to make way into the chamber, marking the start of business on the floor of the House today, 24th February 2025. Enjoy watching Parliament TV.
Members of Parliament! Madam Speaker!
Emma voice. Emma voice.
Tendency of Zambia, proud and free, land of work and joy in unity, victors in the struggle for the right. We want freedom's fight, oh, one, strong and free. Africa is our own motherland, fashioned with and blessed by God's own hand. Let us all our people join as one, brothers under the sun, oh, one, strong and free. One land and one nation is our cry, dignity and peace. Bless our great Zambia, Zambia, Zambia. Remain we stand under the flag of our land. Zambia, praise to thee, O one, strong and free.
Prayer. Almighty God, who in your infinite wisdom and providential goodness has appointed the officers of leaders and parliaments for the welfare of society and the just government of the people, we beseech you to consider with your abundant favor us, your servants, whom you have been pleased to call to the performance of such important responsibilities in this land. Let your blessing descend upon us here in Parliament assembled, and grant that we may, as in your presence, treat and consider all matters that shall come under our deliberation, in so just and faithful a manner as to promote your honor and glory, and to advance the peace, prosperity, and welfare of our country, and of those whose interests you have committed to our charge. Amen.
Being constituted. So for a quorum to be constituted, there needs to be about 1/3 of all the members of Parliament present in the House. That's about 56 members of Parliament. But at the moment, the number is not yet, the number is short, and quorum hasn't yet been constituted. So the bells are ringing.
Yes, the House will resume business as soon as a quorum has been constituted. So expected on the floor of the House is one ministerial statement. We have 8 questions to be considered under Standing Order number 80. These are questions of ordinary nature, and then we have the motion of thanks that was moved by Chikankata Member of Parliament, Honorable Jacqueline Sabao. This is the motion of thanks. The President's address that the thanks of the Assembly be recorded for the exposition of public policy contained in Mr. President's address to the House on Friday, 20th February 2025, when he addressed the nation on the progress made in the application of national values and principles. So we expect the House to start debating this motion this afternoon.
And if just tuned into Parliament TV, as we continue bringing Parliament closer to you, we say thank you very much for choosing to be with us this afternoon, 24th of February 2026. So right now, there is no quorum in the House, but once the quorum is
Order, honorable members, I have 5 announcements. The first one, honorable members, I have received communication to the effect that, in the absence of Her Honor the Vice President, who is attending to other government business, the Minister of Finance and National Planning, Honorable Dr. Stumbeko Musokotwani MP, has been appointed acting leader of government business in the House from today, Tuesday, 24th February 2026, until further notice. I thank you. The next announcement, honorable members, I wish to recognize the presence in the public gallery of 2 members of the public from Nkayema Parliamentary Constituency in Nkayema District. On behalf of the National Assembly of Zambia, I warmly welcome our visitors in our midst. I thank you. You may take your seats. The next announcement, honorable members, I wish to recognize the presence in the public gallery of pupils and teachers from Chainda Community School in Lusaka District. And also in the public gallery, pupils and teachers from Lift Up Academy School in Chibombo District. On behalf of the National Assembly of Zambia, I warmly welcome our visitors in our midst. I thank you. You may take your seats. The last announcement, honorable members, this is more housekeeping. Honorable members, I wish to inform the House that with immediate effect, any honorable member who has been granted permission to attend sittings of the House virtually shall be required at the commencement of each sitting to stand while their camera is switched on during the singing of the national anthem. This requirement is intended to uphold the dignity and decorum of the proceedings of this House, and to ensure that all members, whether physically present or attending virtually, accord the national anthem the respect it duly commands. I trust that honorable members will observe this directive accordingly. I thank you. Urgent matters without notice. The honorable member for Lunte.
Thank you so much, Madam Speaker. Madam, my urgent matter without notice is directed to the Honorable Minister of Education, who is among us today. Madam, we paid all students who went to welcome HH in Kitwe, says NOTEC principal. Madam Speaker, on the Copper Belt, there has been serious problems with alleged students burning T-shirts and causing confusion. And the claim has been these students were not paid as they were promised to go and welcome the president. However, according to the Diggers newspaper of today, the principal of NOTEC has confirmed that all the students who went to welcome the president were paid. Not sure if it's according to the promise. Madam Speaker, my question is, can the Honorable Minister of Education confirm the special allowance which now exists in the tertiary education for welcoming the president, so that our students everywhere across the country can be able to be sure that each time you are released to go and welcome the president, you'll be paid a specific allowance, as the case was at NOTEC, as confirmed by the principal. Thank you, Madam Speaker.
Thank you very much, Honorable Member for Lunte. The matter that you have raised does not qualify to be raised as an urgent matter without notice. The Honorable Minister of Education wants to say something, since there have been serious allegations.
Yes.
But there will be no questions after this.
Absolutely. I mean, if they want, they can still ask. Yes. If they still want, I know this is not their privilege. It's your privilege, Madam Speaker.
You may proceed, Honorable Minister, because we want to clear the air.
Yes.
People out there are listening.
You got to clear the air. You are refusing to accept what you obtained on that side. You are refusing. I was with all these ministers around here. That's right. Honorable Mwet was there, this one was there, everybody was there. There's nowhere where the president invited himself to go there. It's the students who invited him. And the overall boss who was there was Copperbelt Students' Union. NOTEC was one of those. And they spoke at that stage. Please let us not use this as political capital, because you wanted, in fact, they believed that that was true. There was nothing like paying. No, listen. Just listen to me. You are not there. You're asking the Minister of Education, okay? Yes. I'm now responding to you. Okay? Sorry,
Order,
let me just tell
honorable
you that,
members.
first of all, how do we invite a head of state and think that you can be paid? We pay them anyway, every month, meal allowances. Okay? So, which they removed themselves. So, can we clear this? Please also listen to me. Nakonde, you are my brother.
Order, order.
Yes.
Order, Honorable Minister, let me just give guidance. Order, Honorable members. Order, Honorable members. Order, can we have some order? Honorable members, you know according to our standing orders that the information that we give on the floor of the House should be factual and verifiable. This idea of relying on information on social media or in newspapers, let me finish, or in newspapers where you have no facts, you were not there, you don't know what the truth is, it amounts to speculation, is definitely out of order. So let the Honorable Minister, the Honorable Member for Lunte, you had raised a question. And out of that question, the Honorable Minister of Education, I use my discretion to allow him to clear the air from the allegations that you have made. So let's listen to the Honorable Minister respond to your questions. May the Honorable Minister continue.
Thank you, Madam Speaker. First of all, it was inadmissible. But I begged the Speaker in order to answer, because this is what they do. When you tell them that this is inadmissible, the word has already gone. And then we remain vulnerable ourselves not to respond to the allegations which are actually being made. The President was invited by a consortium of students. And I mean a consortium. And don't even say that. You cannot say that to me. So you are showing me your phone. I also have your phone. Okay. So it is your word versus mine. I'm the means of education and I know where I'm coming from. Madam Speaker, for over 4 years, we've been feeding children in universities. Meal allowance which they cancelled, the President said retain it. Feeding more than 4 million children today. And then I can come and have somebody who will question me that you never paid their allowance. How much would it even cost anyway, if that's the case? And for 4 years, we spend billions and billions. They appropriate the money themselves for meal allowances. You do that. Don't even say a point of question. No. So, these people must be told in their faces. I think they are now in trouble because yesterday, as we were feeding 4 million children across the country, they were feeling the pinch. Because the day before yesterday, they were feeling the pinch because the students said they have endorsed the President. It is their right. If they think that they can easily do that. Okay? So this is why they are not happy and they want to bring it this way. In fact, Madam Speaker, I just came here, I was on my way to go and launch another issue of Mulungushi University for building the students' hostels. Okay? So we want me to be pointing you at
Order, honorable members.
who are not in charge. Yes.
Order.
And I think that they really planned this. So you can make all your noise, I'm not deterred as the Minister of Education. That I can tell you. And you must be told in your ability if you're able to be thinking that way. Okay? You will never, and I'm saying you will never. Yes. You can all stand up if you like. You know what happened there? You were with us. Did we coerce anybody? No. Anyone else? Yes. You know that what I'm talking about. This is English. You are uneducated yourself. It's English. You know? He told me, he asked a question. Just sit down. And I think, Madam Speaker.
Honorable members, can we have some order? Honorable member, I have not called upon you, Honorable Member for Lunte. May you please take your seat? Honorable members, you are in a habit of bringing controversial issues on the floor of the House. And when a response is made by the other side, you don't even want to listen, you want to react. That is not democracy that we fought for. Democracy is you ask your question and an answer is given and you listen to each other. It's not while the other person is talking, you are shouting. It doesn't display order and dignity of the House. We are not upholding that order. Even now, Honorable Member for Lunte, you are trying to engage me from where you are seated. What standing order are you using to engage me from where you are seated? Eh? We are coming to the end of the term. Let's finish in good harmony. Yes, respecting each other. Let's make progress. And also uttering language. You know, the official language here is English. If I started speaking Mbunda from here, will you be able to understand what I'm saying? No, that is not the rule here. Huh? You see? Start speaking your language, we will listen. When you are done, then we'll proceed. Now that we have some semblance of order, we can make progress. The Honorable Member for Nakonde. We are still on urgent matters without notice.
Madam Speaker, thank you very much. And I want to correct my elder brother, who is the Minister of Education there, that
Order.
the principal
Order.
of NOTEC.
Order. Honorable Member for Nakonde. We are on urgent matters without notice. Raise your urgent matter without order. Wait, I'm still guiding. Raise your urgent matter without notice. If you have none, can you give to the next person? What's your urgent matter without notice? Honorable Member for Nakonde.
Madam Speaker, thank you very much. The matter I wish to raise, Madam Speaker, is directed at the Minister of Home Affairs and the Internal Security. Madam Speaker, 16 members of Tonse Alliance on Saturday were arrested in the room, even when the Public Order Act excludes such. Madam Speaker, we saw that these members of Tonse, especially those who are supporting the candidature of Honorable Brian Mundubire, were arrested. The incoming president of the Republic. Madam Speaker, they were arrested even when they were in the room. But the UPND members, Madam Speaker, who were in Kabwe publicly, they were not arrested when some of the endorsements were being done. I want to find out from the Minister of Home Affairs and Internal Security if this unlawful assembly crime is only applicable to opposition members, especially those who are supporting Brian Mundubire. Madam Speaker, I seek your serious attention in this matter. I thank you.
Order, honorable members. If Honorable Member for Nakonde, that matter definitely does not qualify to be raised as an urgent matter without notice. We are not a commission of inquiry here to start inquiring on who did what, who was arrested for what. If you have a complaint, you know the authorities to go and complain to. The next, so that matter is not admitted. The Honorable Member for Dudumwezi.
Thank you very much, Madam Speaker. And my urgent matter, without notice, is seeking the attention of the Minister of Agriculture. Minister of Agriculture. First of all, I want to thank the Ministry for having paid all the farmers in Dundumwezi constituency. However, we have some situations, Madam Speaker, where 400 kwachas were deducted from some farmers to enable them qualify to benefit from a FISIP program. However, a number of them, Madam Speaker, did not benefit from this program. May I know the fate of these farmers as to whether they'll be refunded their money or they will be given inputs? Anytime, since the policy of government now is there's no planting season. Every day is a planting season. Can they go to agro dealers and be able to get their inputs? I thank you, Madam Speaker.
Thank you very much. Honorable Member for Dudumwezi, I suggest you put in a question. Since it is relating to farmers and payments of inputs and it is urgent, you can put in an urgent question, which the Honorable Minister of Agriculture can address, as the matter does not qualify to be raised as an urgent matter without notice. Thank you. We make progress. I have permitted the Acting Honorable Minister of Health to present a ministerial statement. The Acting Honorable Minister of Health.
Thank you, Madam Speaker, for giving me this opportunity to render a ministerial statement relating to my ministry that I'm acting. Madam Speaker, with your greatest indulgence, allow me, Madam Speaker, on behalf of your honorable members of Parliament, to thank the Catholic Church, Chifubu, who hosted your members to a prayer session on Sunday, and we were led, privileged so, by the head of state, President Hakainde Hichilema. It shows, Madam Speaker, that despite divergent views, we are actually partners in national governance and national development. And the members, Madam Speaker, included members from both of the aisle, which is a good sign that this House is united. Madam Speaker, allow me also to thank the students of the Copper Belt who hosted His Excellency President Hakainde Hichilema and came in thousands. As former president of UNZASU myself, I was seeing for the very first time student union leaders endorse a president of the state. It shows that this president is a working president and a friend of the students. Because ordinarily, students do not endorse president unless you have gone beyond the reproach in your excellence of service delivery to the nation and to themselves. Madam Speaker, I wish to thank you most sincerely for according me the opportunity to render a ministerial statement to this august House on health issues of public health concern. This ministerial statement will begin by updating the House on the confirmed detection of circulating vaccine derived poliovirus type 2 from an environmental sample collected in Lusaka district. This will be followed by an update on the cholera situation and conclude with the update on the availability of medicines and medical supplies, availability in the country, and the measures that have been put in place to curb the pilferage of medicines and medical supplies in the public health sector. Madam Speaker, on 16 February 2026, the World Health Organization Regional Reference Laboratory in South Africa confirmed detection through the National Polio Virology Laboratory at the University Teaching Hospital of the positive isolation, the poliovirus, from a sample that was sent from Zambia. The sample was collected from Machinchi sewage treatment plant in Lusaka on 29th December 2025 as part of the environmental wastewater surveillance to provide early detection of the virus in the community. The sample was transported to South Africa for initial laboratory testing and sequencing, where the confirmation of the virus was done. It was also established by the laboratory that the isolated virus from Lusaka was closely matched to the virus circulating in Namibia and linked to the ongoing outbreak in Angola. Madam Speaker, Zambia last detected an indigenous wild form of poliovirus in 1995, but has been periodically recording some poliovirus cases, with the last notification before this one recorded on 19th December 2023. This form of poliovirus emerges when a weakened form of the virus normally present in the routine oral vaccine circulates in under-immunized communities and undergoes genetic mutations, reverting to a form capable of causing infection, paralysis, and death. This occurs mainly in settings where vaccination coverage is insufficient to interrupt virus transmission. This detection of circulating poliovirus occurs within a broader regional outbreak. On 11th February 2026, the World Health Organization Africa Regional Office notified Southern African countries of 2 confirmed cases of the virus in Malawi, 1 from an environmental sample and 1 from a 7-year-old child, both linked to a circulating viruses in Harare, Zimbabwe. Close links and free cross-border movement shared challenges in reaching all children with protective vaccine emphasizes the need for strong cross-border collaboration in enhancing public health security. Madam Speaker, the government, through the Ministry of Health and the Zambia National Public Health Institute, has moved with urgency to contain this outbreak. The following actions are therefore being implemented. 1, declaration of outbreak. The Ministry of Health has officially declared a new outbreak of circulating vaccine-derived poliovirus in Zambia as required under the international health regulations. 2, incident management. A poliovirus type 2 incident management system has been constituted to coordinate the national response. 3, field investigation. A risk assessment and detailed field investigation is underway to ascertain potential community transmission. 4, enhanced surveillance. acute flaccid paralysis surveillance and environmental wastewater surveillance have been intensified across high-risk provinces to detect any further spread. 5, vaccination campaigns. The ministry will work in collaboration with the World Health Organization Africa Regional Office to conduct vaccination campaigns using the novel oral polio vaccine targeting all children under the age of 5 in identified areas of risk. Madam Speaker, I wish to reiterate that the government, working closely with cooperating partners under the Global Polio Eradication Initiative, remains fully committed to protecting every Zambian child from polio virus. The early detection of this virus through our surveillance systems demonstrates the effectiveness of our early warning systems and the need for us to enhance access to immunization services for all children across the nation. Update on cholera, Madam Speaker. Madam Speaker, Zambia has been responding to a cholera outbreak first detected on 5th August 2025 in Pulungu district of Northern Province. Since then, 20 districts across 8 provinces have reported cases. Luapula and Eastern provinces have remained free of confirmed cholera cases throughout this period. As of 23rd February 2026, the country has recorded a cumulative total of 954. I beg your pardon, Madam Speaker, to repeat the number. A total of 957 cholera cases and 20 deaths. 10 deaths occurred in health facilities and 10 in community settings, underscoring the continued importance of early symptom recognition and prompt care seeking. Madam Speaker, the cholera outbreak has evolved over time and across geography. Northern Province, particularly Pulungu District, remains the epicenter, accounting for about 70% of all reported cases. Transmission in this region has been prolonged, with periods of decline followed by resurgences, including a second wave in Pulungu. These patterns reflect residual environmental contamination, cross-border population movement, fishing-related activities, and persistent gaps in water, sanitation, and hygiene. From November 2025, transmission shifted southwards and became more centralized, with outbreaks detected in Monze district and later in Lusaka province. This reflects the urban and peri-urban spread linked to population mobility, informal settlements, and sanitation challenges. While several districts have met the 28-day zero reporting threshold, Lusaka province is now the primary focus of transmission, with low-level, geographically widespread sporadic cases across multiple sub-districts and health facilities. Madam Speaker, in the last 24 hours, 4 new cholera cases were reported from Lusaka district. Government, through the Ministry of Health with its partners, has recently deployed and administered 3 doses of oral cholera vaccine to the at-risk population living in Chainda compound in Lusaka to supplement other high-level interventions to combat the outbreak. Dose 1 targeted 35,700 eligible population, of which 35,395, 99.1% were reached. Out of the 35,395 population that received the first dose, 32,987, which represents 93.2%, were reached with dose 2, while 32,474, 99% of those that received dose 2, received the third dose, and final dose. Efforts are underway to administer 3 doses to community members who did not receive the vaccines during campaign period. The Ministry of Health will continue to promote the following. 1. Practice hygiene. Wash hands thoroughly with soap and water, especially before eating, preparing food, or after using a toilet. 2. Handle food safely. Cook food properly. Keep it covered and wash fruits and vegetables thoroughly. 3. Clean surroundings. Keep your environment clean and dispose of waste in designated areas. 4. Avoid unsafe food. Do not consume food from unauthorized or unsanitary vendors. 5. Seek medical care promptly. Visit the nearest health facility immediately if symptoms like diarrhea and vomiting develop. Avoid self-administered medication. Madam Speaker, despite these public health and livelihood threats, our disease surveillance systems remain fully active. Indicator-based and event-based surveillance are functioning nationwide, actively monitoring the situation and informing our multi-sectoral emergency preparedness and response. Additionally, all the health facilities in affected districts remain operational. Outpatient attendance is stable, with no service disruptions reported and no surge in flood-related communicable diseases. However, access to healthcare services remain limited in some isolated areas, particularly parts of Chama district, where flooded rivers continue to hinder outreach and rapid assessments. These challenges are being addressed through coordinated district and provincial actions. I urge all citizens to stay alert, follow public health guidance, and seek health care early. The government will continue to work closely with communities, health workers, and partners to protect lives and safeguard the nation's health. Madam Speaker, may I now update the House on the availability and accessibility of medicines and medical supplies in public health facilities countrywide and the measures taken to safeguard them against pilferage. Essential medicines, vaccines, and medical supplies are critical to the delivery of quality health care. It is therefore government's commitment through Ministry of Health to ensure commodity security, a situation where essential and life-saving healthcare commodities are consistently available and accessible. Madam Speaker, availability of essential medicines at primary health care is at 92%, while in hospitals it is an average at 80%. This is an improvement as compared to the availability that was achieved in September 2025 of 90% and 78% in primary health care and in hospitals, respectively. These achievements are attributable to yearly increased budgetary allocation for procurement of medicines and medical supplies, which is 6.4 billion in 2026, improved procurement efficiency, and improved supply chain management. Madam Speaker, the government, through Ministry of Health, is committed to ensuring accessibility of healthcare commodities by all Zambians wherever they are and prevent pilferage of these commodities. In order to curb pilferage, multi-agency task forces have been established at every level of the healthcare system. To ascertain accessibility of the commodities by clients and patients, a survey on medicines access was conducted countrywide in December 2025. The report is yet to be published as data analysis is still ongoing. Madam Speaker, as I conclude, I wish to inform this august House and the nation at large that the Ministry of Health will hold a public open day within the first quarter of 2026. This important occasion will provide an opportunity for members of the public as well as stakeholders to engage directly with the various arms of the Ministry of Health. The public open day is designed to foster inclusivity, transparency, and accountability in the delivery of health services, thereby improving positive public perception and increasing publicity on the services provided by the ministry. Madam Speaker, I thank you.
Thank you very much, Honorable Acting Minister of Health. Honorable members are now free to ask questions on points of clarification on the ministerial statement presented by the Acting Minister of Health. The Honorable Member for Chitambo.
Minister, thank you very much for the timely statement that you've given the House. My question is, you did indicate that samples were taken to South Africa. These were gotten from the Manchichi drainage. Is the minister telling this nation that we don't have the infrastructure in Zambia to carry out such investigations and give us a result? I thank you, Madam Speaker.
Thank you. The Honorable Acting Minister of Health.
Madam Speaker, the situation to do with the current regional outbreak of polio has to be coordinated at regional level, hence the need to have the verification of the presence of this type virus, polio virus type 2, to be verified at the regional office in South Africa. I thank you, Madam Speaker.
Thank you very much. The Honorable Member for Kwacha.
Indeed, thank you so much, Madam Speaker, for the opportunity given to ask a follow-up question to the Acting Minister of Health. And also thank you, Acting Minister, for that timely ministerial statement that you've just issued. Honorable Minister, polio is a deadly disease which, if left unchecked, can have a very, very serious effect on our communities, especially the young ones. In your ministerial statement, you have indicated that you only undertake vaccination in areas where it is highly suspected. But don't you think, Honorable Minister, it would be ideal for my government to spread this vaccination almost everywhere because of the nature of the human beings? There are movements taking place, even as we speak, from those affected areas where there could be a high chances of people coming from suspected areas spreading to almost the entire country. So don't you think it would be ideal to have this vaccination to be undertaken countrywide? Thank you, Madam Speaker.
Thank you very much. The Honorable Acting Minister of Health.
Thank you very much, Madam Speaker, and I would like to thank the Honorable Member for that very good question. Madam Speaker, that question also gives me an opportunity to clarify that even as we talk about polio outbreak in this region, particularly now in Zambia, there is no, and I must ask the members to underline, there is no known case of any human being being found with a polio virus. What has been found is a virus in the sewer waters at Manchinchi, which is indicative, therefore, that it is actively present, but no human being has this far been detected with polio virus. Notwithstanding, Madam Speaker, because of the regional nature in which this outbreak has been reported, it is advisable by health experts that in those areas that are proximate to the countries that are affected by polio, then vaccinations must be conducted as a preventative measure, not a curative measure, Madam Speaker. That is the situation. And in medicines, Madam Speaker, you target a problem, you don't go wholesale, even where a problem doesn't exist. Madam Speaker, I would also like to indicate here that the vaccinations for polio at national level are an ongoing, routine, ongoing program. It is not just a response to this particular issue, but that this particular issue is being given specific attention because there can be recurrence even in communities that have already been vaccinated. There can be a resurgency if left unchecked, hence the need to target those areas that are proximate to, which we refer to in the statement as risk areas. So as we stand, there is no medical emergency to begin a wholesale, nationwide, vaccination responding to this, yet in terms of routine vaccination, that is already ongoing at national level. I thank you, Madam Speaker.
Thank you. The Honorable Member for Shiwangandu.
Thank you so much, Madam Speaker. Madam Speaker, and before I pose the follow-up question to the Honorable Minister, just allow me to also express and press on record my sincere concern that I heard the Honorable Minister acknowledge the students.
Order, Honorable Member for Shiwangandu, order. Order, Honorable, let me give guidance. Honorable Member for Shiwangandu, we have closed that chapter. We don't want to start to open it. So just ask your point of clarification. Do not comment on what happened when the Honorable Member for Lunte asked the Honorable Minister of Education a question. We want to proceed in order. May the Honorable Member for Shiwangandu continue.
Madam Speaker, thank you. I hope you give me an opportunity just like the Minister had one. But for now, I want to just pose a question to him. Honorable Minister, you gave us an update on the stock levels of essential medicines in the hospitals. But we have continued to receive reports from our citizens who go to the hospitals and they are not able to get most of these essential medicines, and that the medical staff have also been instructed not to issue prescriptions to patients so that they don't show the alarming status of the lack of these essential medicines. And there is an issue of lack of oxygen, which is making patients being turned away, like Levy and also UTH, from operations, and that the suppliers of oxygen are not being paid by the ministry. If the status you are giving us is what is obtaining, where is the challenge? I thank you, Madam Speaker.
Thank you, the Honorable Acting Minister of Health.
Thank you, Madam Speaker, and I would like to thank my colleague, Honorable Kampiongo, for bringing that question to the fore, to give us an opportunity to correct this misinterpretation, this misnomer about shortage of medicines in our health facilities. I would like to answer his question in the following terms, Madam Speaker. Firstly, that there is a lot of misinformation out there coming out of the abuse of social media, where anyone without empirical and authentic information will channel out information to say at such a health facility there is a shortage of medicines. Yet on the ground, when you go to verify with official status records, you will find that it is contrary. Only 2 days ago, Madam Speaker, you might have seen some controversy around the same, with the people who were posting those alleged shortages failing to substantiate their claims. And it is for that reason of misinformation and disinformation, sometimes even for, unfortunately, political reasons, that the Ministry of Health now has thought of coming up with this Ministry of Health Open Public Day for members of the public to interact directly with the ministry in order to get facts as they obtain and also see where they can access information relevant to their knowledge. Madam Speaker, President Hakainde Hichilema has made it possible now through the Access to Information Law, which was passed in 2023, that anybody who wants information of coming out of public offices, they can go and find out. I'm concerned, Madam Speaker, that this senior honorable member of parliament has come here to say, we hear. When he knows that this house does not entertain hearsay or innuendos. Madam Speaker, I would have expected the honorable member to adduce evidence arising out of facts obtaining on the ground. Nonetheless, in the second limb, Madam Speaker, I would like to answer my own good friend, the honorable member for Shuangandu, Honorable Kampiongo, that, Madam Speaker, these shortages sometimes are recorded because you cannot attain 100% record at a health facility because these are consumables throughout. So unless you close a hospital and do stock taking like they do at a pharmacy or at a shop, that is the only time you are going to say the stock levels are at this particular percentage is below, why not 100%? Otherwise, these are consumables and perishables in certain instances, as the case in Kasu that my own friend, Honorable Kampiongo, has hitherto referred to. That is to say, oxygen. It's a perishable. And sometimes at a time, it is still in transit. Maybe just at the nick of the moment, someone will quickly report shortage. Otherwise, the government and the ministry are on top of things to ensure that these life-saving medicines and medical supplies are always in ready supply, and this is the situation as it obtains on the ground. Madam Speaker, I thank you, Honorable Kampiongo.
Thank you. The Honorable Member for Maternal.
Thank you, Madam Speaker. And Madam Speaker, just to place on record that whenever the people of Maternal ask questions, it means they've done thorough research. Even after the question is answered, when they walk out.
Order, Honorable Member for Maternal. Order, let me guide. Whether or not the Honorable Member for Maternal has done sufficient research will come out as he asks his question. May the Honorable Member for Maternal ask the question.
Madam Speaker, I was just saying that when we were out, we were at the library researching some more for the question. Honorable Minister, Acting Minister of Health, Minister, in the year between 2017 and 2021, in this city of Lusaka, when the council was controlled by the then ruling PF
under President Edgar Lungu and the able mayor at the time, there was no reports of any waterborne diseases.
Who was the able mayor? You are not disclosing all the facts.
Yours truly, Madam Speaker, Emmanuel Walia Mao Sampa, speaking. Madam Speaker, there was zero report of cholera, zero report of typhoid, zero report of dysentery. Now there is reports of dysentery for little kids in school. All those diseases are due to lack of sensitization for the 2.2 million people of the city on cleanliness and no proper cleaning of the city. Madam Speaker, now we're having the minister issuing reports of this unheard of diseases like typhoid, and cholera has been recurrent every year since 2021. Madam Speaker, is that an indictment on this government and their controlled Lusaka City Council and the central government on the failure to keep Lusaka City clean? Madam Speaker, I thank you.
Thank you very much. Do you have anything to lay down on the table? Or the research is in the scope? The Honorable Acting Minister for Health.
Thank you very much, Madam Speaker. I'd like to thank the Honorable Mayo Sampa, MP for Maternal, for that well-created platform for me to respond to him in the following terms. Madam Speaker, that firstly, there is no evidence of research in that question. Because cholera, Madam Speaker, under the former administration of Patriotic Front, save for the year 2019 when there was a drought. Because when there is a drought, there is little water, which is a platform or a vector that gives rise to spread of waterborne diseases. There was no cholera. Maybe that's the only year he's referring to. Outside that, Madam Speaker, cholera was a yearly ceremony with limited intervention. And Madam Speaker, coming to 2021, even without stretching the argument, from 2021, Madam Speaker, the able mayor, who was, as he then was, but now is a member of parliament, has been one of those members of parliament from the Patriotic Front dominating the Lusaka City Council. And also, the mayor for Lusaka City Council is from the same party and cut from the same cloth as the former mayor, who is now the MP. And the job of sensitizing citizens, Madam Speaker, of public health concern is a preserve and mundane obligation of the council. So, some of the members of that council, particularly those who then were but are no longer, but now occupy a certain other disposition, have been a total letdown. Because if they had succeeded, assuming that was the truth, they are now in a higher position to have contributed even more. Madam Speaker, I thank Honorable Sampa for bringing humor to this House. I thank you.
The Honorable Member for Mbabala.
Thank you so much, Madam Speaker. And thank you, Honorable Acting Minister.
The Honorable Member for Mbabala, there is an indication for a point of order. What's the point of order, Honorable Member for Shwangandu?
Thank you, Madam Speaker. Madam Speaker, my point of order is directed to my honorable colleague, the Acting Minister of Health, who is also government spokesperson. Madam Speaker, our role here as people's representatives is to ensure that the concerns of the people we represent are brought to the fore. Here, Madam Speaker, We brought you the same concerns, and you were gracious enough to assign your committee on health matters to go on the ground and verify the matters we were lamenting about. And these were issues to do with shortages of drugs. And the report which came here verified our concerns. Madam Speaker, apart from us being people's representatives, we also go to the same facilities, same hospitals. When I was posing my question, Madam Speaker, it was well informed. And the Honorable Minister opted to kind of politic and it trivialized the matters that I raised. Madam Speaker, the issues of oxygen are matters of life and death. There are people whose operations have been rescheduled on account of, Madam Speaker, you need to discipline some of these minister colleagues. That's why it's a win and a ball.
Order, honorable members. Let's raise the point of order. Honorable member.
Madam Speaker.
Order, I'm guiding. Honorable member for Shiwangandu, ask your question. Don't debate not question. Raise your point of order. Do not debate the point of order. What is the breach that has been occasioned by the Honorable Acting Minister of Health? You may proceed. Raise your point of order. Please, can we listen to the point of order also without interruption?
Madam Speaker, was the Honorable Minister in order to opt, rather to avoid responding to my question as I posed it to him and gave the responses that were not speaking to what is obtaining on the ground. And if the minister is not sure, because we normally depend on your technocrats, it would be important, Madam Speaker, to get, I would invite him to go to some of these facilities and see for himself what is obtaining on the ground. Madam Speaker, I was in order to ignore responding to my question.
Thank you very much, Honorable Member for Shiwangandu. The issue that you keep on raising about the report by the Health Committee, that was 4 years ago. I think even last week you said that, and I guided that. That was 3-4 years ago. There has been no study that has been done to verify all the honorable members. There has been no study that has been undertaken to find out the state of medicines in our hospitals. I was expecting that as honorable members raise this issue, they'll be able to lay something on the floor, on the table of the House, so that the honorable minister does not start speculating, or the honorable member does not speculating in trying to ask and also trying to answer the question. Honorable members, our standing orders are very clear. An issue that is raised on the floor of the House must be factual and must be verifiable. Even from the tone of the honorable member for Shiwangandu, as he was asking his question, there was no conviction, according to me who was listening. There was no conviction in that question. So, honorable members, when we ask questions, let's have facts. Honorable member for Shiwangandu has not presented any facts to support his point of order. And he was also debating and rendering advice to the honorable minister, acting minister of health. I would suggest that when you find time over tea, you can have a chat if you want to give advice so that we can make progress. The honorable member for Mbawala may continue.
Thank you so much, Madam Speaker, and thank you, Honorable Acting Minister of Health, for that very progressive and informative statement. Honorable Minister, you talked about the expanded program on immunization in the country, which we are very happy that under the new Dawn UPND government, it has received increased funding in line with the budget from 206.8 million in 2025 to 270.9 million in 2026, which is an excellent improvement. So, Honorable Minister, this money is mostly going to the cold chain and the other vaccine-related matters. Is the ministry, therefore, with this discovery which you have mentioned to us, looking at putting some money to improve on the surveillance and monitoring and evaluation matters, which are also critical to ensuring that the national immunization strategy remains on course and is able to help us detect and prevent such epidemics like you have indicated this on this alert? I thank you.
Thank you. The Honorable Acting Minister of Health.
Thank you very much, Madam Speaker, and I would like to thank the Honourable Member of Parliament for Mbabala for that particular submission. Madam Speaker, my response would be to indicate that these are policy positions that the ministry has to take after carefully studying how sustainable the budget would be should the ministry decide to go in that direction of consideration. So things remain in situ as they are for now. Madam Speaker, I thank you.
Thank you very much. I'm informed that Honorable Member for Chilubi, who is joining us via Zoom, wants to ask a question. Honorable Member for Chilubi.
Thank you, Madam Speaker. Thank you, Madam Speaker. I would like to get from the Minister the status of the oxygen plants that are at different hospitals, because oxygen is a critical component in making sure that some of the conditions that are health-related are managed. What is the status of oxygen plants on different hospitals? There being Dola, Kabwe, and many more. What is the status? Because he was talking about transporting oxygen from one point to the other.
Thank you. The Honorable Acting Minister of Health.
Thank you very much, Madam Speaker. In the statement that we gave percentages relating to the availability of medicines particularly, and the issue he is referring to, Madam Speaker, is to a particular supply which is a perishable, to which for now, since he's just asked off cuff, I may not be in a position to give him the answer he's seeking, as it would appear to me in the present circumstances to be a new question. I thank you, Madam Speaker.
Thank you very much. The Honorable Member for Ron.
Madam Speaker, thank you very much for the opportunity to ask a follow-up question to the Acting Minister of Health. Minister, in your statement, you had indicated equally the outbreak of cholera in some parts of our country, and you gave the statistics in terms of numbers, of admissions, and indeed of those that died. Honourable Minister, cholera is a very contagious disease, and as usual, your ministry always tries to prepare itself in terms of the facilities. Madam Speaker, I would want to find out from the Minister as to whether these cases of cholera were treated as isolated or they were taken to the health facilities, or in short, Honourable Minister, have you identified the facilities that are supposed to handle these cholera cases instead of mixing the cholera cases with the health facilities that are away from the cholera issues? I thank you, Madam Speaker.
Thank you. The Honorable Acting Minister of Health.
Madam Speaker, I want to thank the Honourable Member for Ron for that good question. Madam Speaker, earlier on I did give indications of the statistics of the number of people who have died in our health facilities and those who have died in community settings. Madam Speaker, I think I have them somewhere here for ease of reference. I need to give the honorable member the actual numbers so that, because last time when I didn't answer him properly, the session extended to Parliament Motel, Madam Speaker. So let me just look for the correct information. Madam Speaker, all health facilities are able to handle cholera cases. Isolation wards, beds are always put in place at health facilities. Perhaps you are referring to those situations where you open such a vast public place like the last time Independence Stadium. It is at those levels when the situation gets out of hand and it is almost an emergency situation. In the ordinary sense, as things are obtaining, Madam Speaker, all health facilities are equipped to handle cholera situations. And I would like also to take advantage to indicate to the honorable member that if it is Lusaka, for instance, we have 11 patients currently under admission in Lusaka, 8 at Munali sub-district, and 3 in Kanyama. Madam Speaker, I thank you.
Thank you very much. The honorable member for Nyimba.
Thank you, Madam Speaker. Minister, I'm scared in Mpurongo we might lose our minister. Is always in the constituency, Madam Speaker. I hope he's very safe in Mpurongo. Minister, we all know it's a known fact that Lusaka is one of the deadliest cities in our country, and cholera has been a traditional ceremony in Lusaka. So is in Mpurongo. Minister, you gave the statistics of people who have been vaccinated. Now, maybe I missed you. I just want you to tell me the efforts I think it should be last year, you had put in vaccination, especially in Lusaka City. And those statistics you are giving us are coming from Lusaka. Did you do, or did you add the same energy or efforts? Did you put in the same efforts in the small town of Mpurongo to see to it that our people in Mpurongo, including our minister there of Northern Province, is safe, and the people who are fishermen there in Mpurongo are safe and protected, Madam Speaker, so that we do not see our colleagues from that area of the country dying, because we've got ministers who are coming from that side, like the Minister of Sports. I thank you, Madam Speaker.
The cousinship extended. The Honorable Acting Minister of Health.
Madam Speaker, yes, the honorable member was asking a very good question, and I think at some point I lost him. With your greatest indulgence, Madam Speaker, I asked that the honorable member repeats his question, but to be so succinct that I'm able to get it, because if he makes it so elongated, meandering, whining, and wandering, I'm left behind, Madam Speaker. I want to furnish this House accurate information, because, Madam Speaker, that is why I'm here. Can the honorable member repeat the question for the sake of me giving correct information to this august House?
The honorable member for Nyimba, please repeat your question.
Thank you, Madam Speaker. Minister, you had put in a lot of efforts in Lusaka, and we all know the reason why is that Lusaka is dirty, and the cleaning levels of Lusaka, especially in Kanyama and Soweto areas, has been, the system has let us down. Not from now. I think it's this issue. It has taken time. Now, Minister, the effort you had put in Lusaka to vaccinate people, did you do the same in Mpurongo so that we save our families in the small town of Mpulongo. I thank you.
That question was loaded. It even made the power go. The Honorable Acting Minister of Health.
Thank you very much for that question succinctly asked. Madam Speaker, the Honorable Member for Nimba would like to find out if we are putting the same effort. So, Madam Speaker, I was wondering what would constitute effort so that I'm able to gauge whether we are putting the same effort in Lusaka as it was and as the case obtains in Mpulongo. Given that the effort to put is determined by the severity and enormity of the task. Like you have indicated, Lusaka is the dirtiest. So you'd expect that beyond vaccination, you will see that ZNS will swing into action, for instance, to do drainages as they have done. There will be all these interventions by government. The Ministry of Water will come in to erect water tanks and also provide water bowsers to be able to distribute safe and clean and safe drinking water. So that is because of what you have hitherto elucidated and referred to and characterized as being the dirtiest Lusaka. That is why that effort is deployed. And you'll find that the Ministry of Local Government will also be at full strength in responding. So for a small town like Mpulongo, Madam Speaker, vaccination, which was duly conducted, is sufficient. Surely should we go and begin to take ZNS to dig canals, or drainages in Mpulongo, when we know that the major source of the vector conveying of the disease is fish trading, which can easily be controlled or banned. So we would be asking for too much to expect that we would deploy the same as government effort in Lusaka, which you have said is the dirtiest, as it should be in Mpulongo, because Mpulongo's situation is unique to itself, and therefore its response will be restricted to the necessities required for Mpulongo, such as the vaccination which was done. Madam Speaker, I thank you.
Thank you. And with that concludes that question session. Questions for oral answer under Standing Order 80. Honorable members, in accordance with the Standing Order 61-1, I have rearranged business on the order paper to allow the Acting Minister of Health to respond to question number 216 before question number 209. The Honorable Member for Chinsali.
Thank you, Madam Speaker. Question number 216.
Thank you. The Honorable Acting Minister of Health.
Madam Speaker, thank you. The Honorable Member of Parliament, Honorable Mkosa for Chinsali, asked the Minister of Health, at A, how many cases of maternal and infant mortalities were recorded in Chinsali district from 2022 to August 2025, year by year. At B, what the causes of the mortalities were, and at C, what measures the government is taking to reduce the mortality rates at A. The response, Madam Speaker, at A, the number of maternal mortalities, Chinsali District Hospital, 2022, 7, 2023, 2, 2024, 2, as of August 2025, 3. Infant mortalities, Chinsali District, 2022-18, 2023-2, 2024-1, August 2025-4. At B, Madam Speaker, the common causes of the maternal mortalities include 1, bleeding mostly after birth and in some instances in labor and before labor. 2, this was as a result of delays in accessing health care because of late decision-making to take the mothers to the health facilities, long distances, poor road network, and lack of mothers' shelters for mothers to await delivery at the health facility. 3, raised blood pressure, in some cases accompanied by fits. 4, heart diseases in pregnancy. And 5, other infections attendant to the patient. Madam Speaker, the common causes of the infant mortality rates include 1, being born prematurely, 2, malaria, 3, hypothermia, that is to say, failure to keep babies warm, and 4, infections. C, Madam Speaker, the measures the government is taking to reduce the mortality rates include 1, recruitment of more skilled healthcare workers to offer services, Madam Speaker, just like the government is presently doing. 2, improvements of the road network by leveraging on CDF. 3, construction of maternity annexes to ensure mothers are brought closer to the facilities to await delivery. 4, procurement of ambulances for quick referral of maternity cases, which has helped a lot. 5, recruitment of polyvalent community-based volunteers who are a link between the communities and the health facilities as far as primary health care is concerned. 6, community engagement for community mobilization. 7, increased funding allocation for reproductive health programs. Madam Speaker, I thank you, and I thank the honorable member for the question.
Thank you. Supplementary questions, the honorable member for Chinsali.
Thank you, Madam Speaker. Madam Speaker, I've noticed that in the answer by the honorable minister, in the year 2022, the number of the maternal mortalities and the children, the young ones that died, the babies that died, seems to be too much higher than compared to the other years, because like in 2022, there's 18 infants that died. Then in the other years, it's 2, 1, and 4. So is there any specific reason why these two numbers are higher in 2022 compared to these other years? I thank you, Madam Speaker.
Thank you. The Honorable Acting Minister of Health.
Thank you, Madam Speaker. That question, Madam Speaker, is issue specific, and how I wish the honorable member had it in contemplation that there could be such variances so that we would have prepared to give medical responses other than leaving me now to the vagaries of assumption as I now wish to perform, that the only reason perceivedly and manifestly and patently self-evident to me when I look at these statistics is the fact that in 2022, the new Dawn administration had just taken over a government which was poorly funding the health sector, and progressively therefrom the health sector budget began to increase. You remember that in 2023, the new Dawn administration under the able leadership of President Hakainde Hichilema recruited 11,000 health workers. those health workers now deployed, one would arrive at a very safe conclusion that that is the reason why healthcare provision in our health facilities has improved. Recruitments, more funding, more equipment, now have bought ambulances through CDF. We do expect that going forward with these interventions, these mortalities will continue to decline because the government is responding to these challenges accordingly. I thank you, Madam Speaker.
Thank you. The Honorable Member for Chiengi.
Thank you so much, Madam Speaker. Minister, I listened to the plan that the government has in order to reduce these mortalities and the maternity or during childbirth. Now, I wanted to find out, that sounded like it's a long term. Are there any short-term plans that the government can put in place so that we start reducing the these childbirth mortality that has rampant our country? Thank you, Madam Speaker.
Thank you. The Honorable Acting Minister of Health.
I thank the Honorable Member of Parliament, Madam Speaker, for Chiengi, also known as Renshina, for her question. Madam Speaker,
since the Honorable Member for Chiengi is not protesting, I've got nothing to say.
Thank you, Madam Speaker. Madam Speaker, the measures that government has put, and for avoidance of doubt, have already been enunciated upon in terms of C. They have already been enunciated upon and elucidated upon and ventilated upon.
Order. Order. Honorable Member Fonkana, please, the official language here is English. Don't engage the Honorable Minister in a language which is not, you are not even interpreting what you are saying. Can we use the English language, please, so that everyone can hear? May the Honorable Minister continue.
So, Madam Speaker, these measures of government as being requested by the Honorable Member of Parliament for Chiengi have already been spelled out, and the strategies are ongoing, but the short and medium term and long term interventions have been spelled out. And I would like to ask the Honorable Member for Chiengi if she was not clear what we read out at C. Honorable Renshina, I'm available to share this document with you immediately after this session. I thank you, Madam Speaker.
Thank you. An invitation to treaty. The Honorable Member for Chinsali.
Thank you, Madam Speaker. Madam Speaker, when the Honorable Minister was providing the answer to my substantive question, he indicated that among the measures that the government is taking includes recruitment of health workers. Therefore, Madam Speaker, I would like to ask the Honorable Minister what the government is planning to do, what his ministry is planning to do to address this problem that is there, that when you recruit health workers, say, for example, nurses, you recruit them at, say, Chilunda Health Facility, but because they are related to one or two government officials, they just go and report for 2 days, then they go somewhere else, and the health facility at which that person was recruited still remains with a vacancy or without a health worker to be attending to patients. Those are the problems that we've been experiencing in these rural areas where we are, Madam Speaker. I thank you.
Thank you. The Honorable Acting Minister of Health.
Madam Speaker, I would like to thank the Honorable Member for Chinsali for bringing that particular concern to the fore. And Madam Speaker, I will not be at variance with his observation because even President HH has acknowledged this problem that we have people who apply for public service jobs, but once employed and deployed, where they are taken, many of them, they find that the conditions there are not what they would like to be inhabitants for. They opt to request for early exit by way of alleging even marriage or being sick, you need to be nearer to a better health facility, and so on. So that is, Honorable Member for Chinsali, an existential problem which government is aware of, to the extent that President HH has actually said that those public service workers, and this is not limited to and restricted to health workers, including teachers and other professionals. Now, Madam Speaker, strangely, we even have soldiers. Me, they phone me, transfer me from Mushiri Barracks to Choma ZDN, to Choma Zambia Army. This is what the country had become, Madam Speaker, a country of favors. And that is why, under the able leadership of President Hakainde Hichilema, he has said, anyone who gets employed in this public service, you report there and you say you can't work there, then you must consider that you should abdicate that job for another who is willing to serve citizens anywhere. But even before we reach to those extreme ends, Madam Speaker, President Hakainde Hichilema has enhanced the CDF and hitherto came here, even when he came here last week, urged the members of this House to consider progressively be allocating sufficient funds to the construction of facilities such as houses with flush. And I remember him talk about flushing a toilet in Chieng, for instance, that a nurse who finds such a facility is likely to be attracted to stay there and not request to come back. So this is a problem which we must be able to come together to resolve. It was left by PF, and because they are the ones who created it, they might have an idea of how we can unravel this and come to normalcy. Madam Speaker, I thank you.
Thank you very much. We make progress. Next question, the Honorable Member for Chinsali.
Thank you, Madam Speaker. Question number 209.
The Honorable Minister of Water Development and Sanitation.
Thank you very much, Madam Speaker. Before I answer this question, I just want to congratulate His Excellency the President, Mr. Hakainde Hichilema, for the many achievements so far. Free education, school feeding programs, bumper harvest, peace and security. Madam Speaker, Honorable Kalalwe Mukosa asked the Minister of Water Development and Sanitation in A, whether government has any plans to construct sewer systems in the following areas in Chisali District. 1, Muliangolo, 2, Kabuta, 3, Seed Farm, and 4, Chandamali. If so, when the plans will be implemented. C, if there are no such plans, why? Madam Speaker, in response to the questions asked by the Honourable Member of Parliament, I wish to inform this House that in A, yes, government has plans in the short to medium term to construct, rehabilitate, and expand the existing storage infrastructure in Chinsali District, including the currently unserved areas of Muliangolo, Kabuta, Seed Farm, and Chandamali. These interventions form part of government's broader program aimed at improving sanitation services, safeguarding public health, and enhancing living conditions in urban and peri-urban areas. In B, Madam Speaker, government through Chambeshi Water Supply and Sanitation Company has scheduled to undertake feasibility studies, detailed engineering designs, and environmental and social assessment this year and next year. The outcomes of these preparatory activities will determine the technical scope, implementation, phasing, and financing requirements for the expansion of sewer networks, rehabilitation of water treatment, waste treatment facilities, as well as the establishment of structured fecal sludge management systems and strengthened on-site sanitation systems in Chinsai district. During this same period, government will therefore prioritize resource mobilization to support these preparatory activities as well as the actual construction works. See, Madam Speaker, as indicated above, government has plans indeed to construct and rehabilitate the existing sewer network to the new unserved areas of Chinsali. Madam Speaker, I thank you.
Thank you. Supplementary questions. The Honorable Member for Chinsali.
Thank you, Madam Speaker. Honorable Minister, you have indicated in your answer that government has plans, of course, through Chambesh Water and Sewerage, to start undertaking a feasibility study to see how they can construct the sewer system for Muriangolo, Kawuta, Chandamali, and the other mentioned places. Now, I would like to find out, you said this year and next year. When exactly this year will Chambesh Water and Sewerage Company start undertaking that feasibility study, and kindly confirm if they have been financed accordingly to undertake that exercise? I thank you, Madam Speaker.
Thank you. The Honorable Minister of Water Development and Sanitation.
Thank you for that very, very important question. I can confirm that, yes, government has funded the water utility to start these works, the visibility studies. I can also confirm to you that the preliminary feasibility studies have established that we need in an amount of about 110 million kwacha for us to come up with a comprehensive system for Chinsali. So yes, indeed, government has started, and we are very, very sure that we will provide the good people of Chinsali with this sewerage network. Madam Speaker, I thank you.
Thank you. The Honorable Member for Chinsali.
Thank you, Madam Speaker. Honorable Minister, at the moment, we are talking about this issue of sewer or sewer line in Chinsali after houses have already been built. Now, we will not talk about odd establishments or odd settlement areas. We will talk about, say, for example, Muriangolo, which is quite recent, like a new establishment. Why is it that your ministry doesn't work in collaboration or in coordination with the local authority so that whenever they are about to start giving out land in a new area, they should ensure that sewer lines are done? Because you find in most of these areas, what people use are just these septic tanks and these things that people just do for themselves. And this is the reason why we are having these diseases such as cholera and other diseases like typhoid and others. So why is it that your ministry doesn't work in collaboration with the local authorities to ensure that sewer lines are done before they start selling land? By the time people are building, there should already be systems put in place that when a person builds a house, they should just connect to the sewer line. I thank you, Madam Speaker.
Thank you. The Honorable Minister of Water Development and Sanitation.
First and foremost, I want to confirm that, yes, indeed, we work very closely with the Ministry of Local Government and Housing in providing these services, very, very closely. However, Madam Speaker, establishment of sewer networks is an expensive venture. Most of these networks, basically, the ideal situation would have been that all the infrastructure, water, roads, sanitation facilities are established before establishment of these localities. However, these localities have been in existence for a long time. Some of them, actually, we should also talk about both the old and new infrastructure. Because for the old infrastructure, we are slowly and surely graduating them into structures which are connected to the main lines. Because the on-site sanitation services have proved to contaminate a lot of groundwater. So we are trying to graduate them to these systems. Madam Speaker, what we have started doing as well is to ensure that we find enough funding for us to ensure that all the new areas where our good people in Chinsali are establishing their houses, they find networks where they can easily connect to these sewer networks. So in short, just to confirm that we are working very, very closely with the local government through their various councils to ensure that we have elaborate systems where our people can connect and avoid water contamination, they avoid outbreaks of diseases which come about because of contaminated water. Madam Speaker, I thank you.
Thank you very much. The Honorable Member for Chenge, I was almost closing. Moving to the next.
Thank you so much, Madam Speaker. Honorable Minister for Water and is it sanitation? Madam Speaker, I'm worried that the minister has referred to old structures, but I believe in Zambia, most of people want to own properties like housing properties. Can't this ministry come with a policy that no one should be issued with a plot which is not serviced? Because this will continue, and the minister is saying when they find money, and the money will never be enough, and the money will not be found like today. Can't this ministry bring here a bill so that the local government or the Ministry of Lands should know that they can only issue plots or allocate plots where they know the place is already serviced? Because we are talking about lives here, Madam Speaker. People they end up drinking contaminated water. Can't this ministry come up with that bill? Thank you, Madam Speaker.
Thank you. The Honorable Acting Minister of Water Development and Sanitation.
Madam Speaker, the question was a bit confusing because she's requesting the Ministry of Water and Sanitation to come up with a bill to compare with the Ministry of Local Government and Housing, not to issue plots. I would advise that maybe this question is directed to the Ministry of Local Government and Housing. Madam Speaker, I thank you.
Thank you. Let's make progress. The next question, the Honorable Member for Kabushi.
Thank you, Madam Speaker, for giving the people of Kabushi an opportunity to ask a question. Question 210.
The Honorable Minister of Local Government and Rural Development.
Madam Speaker, thank you so much for the opportunity given. The Honorable Member of Parliament for Kabushi, Honorable Bernard Kanengo, asks the Minister of Local Government and Rural Development whether the government has any plans to help farmers in Kabushi parliamentary constituency who got loans under the Constituency Development Fund in the year 2023 to purchase farming inputs, but were affected by the drought of the 2023-2024 farming season. If so, when the plans will be implemented, and if there are no such plans, why? Madam Speaker, the government has no plans to pay or consider phasing out the loans gotten in the year 2023-2024 farming season. A reason being the fewer parliamentary constituents needed to do the following. The procedure to attend to disasters, the following should have happened. One, the farmers in Kabushi should have reported to the Satellite Disaster Management Committee in their area, who would have in turn reported to the District Disaster Management Committee headed by the District Commissioner. Two, the District Disaster Management Committee would have then reported to the Provincial Disaster Committee, who would have in turn sent a report to National Disaster Management Committee under the Office of the Vice President. Such a report would have been presented to the Committee of Ministers chaired by the Vice President. The Committee of Ministers then would have made a resolution on the course of action. Government, however, did not receive any report in accordance with this procedure. In the absence of this report, Madam Speaker, the government cannot take action, any action, sorry. Currently, those who have challenges in paying the loans, not only those who got and plowed the money into farming, buying of farming inputs, but whoever got a loan under CDF and they have challenges, let them see the local authorities in their respective areas so that they may be considered on some negotiations on how they can ease the modalities of payment. But all in all, resources need to be paid. Thank you so much.
Thank you. Supplementary questions. The Honorable Member for Kabushi.
Thank you, Madam Speaker. The WDC and Kabushi CDF acted within the confine of the law by selecting the beneficiaries, and the guidance they used is that the beneficiaries must be vulnerable but viable. Being vulnerable, we are very sure, Madam Speaker, to say people who lost money in that way cannot pay. However, Honorable Minister, is your ministry contemplating to bring a bill here that will ensure that these CDF loans are insured? I submit, Madam Speaker.
Thank you. The Honorable Minister of Local Government and Rural Development.
Madam Speaker, thank you so much, and I would like to thank my dear colleague for a follow-up question. Basically, that is a double-edged sword, Madam Speaker. There can be a private member's motion, he brings it, there is no problem. Before the government thinks he's here to enjoy those incentives. Thank you so much.
Thank you. The Honorable Member for Chinsali.
Thank you, Madam Speaker. Madam Speaker, I would like to talk to the Honorable Minister that government, Madam Speaker, is there to provide leadership to its people. In 2023, Madam Speaker, there was a drought, and it is a known fact by everyone. That is the reason why the President even declared that drought as a national disaster. Now, the Ministry of Local Government knew very well that there are some people in Zambia who were beneficiaries of loans, who got loans that they were going to invest in farming business. So the Ministry of Local Government knew very well that some people that we have given loans have suffered a drought. Why didn't they take... No. Madam Speaker, the Honorable Minister of Youth, he keeps on disturbing me, but he has stopped. Madam Speaker. Now he's even making me lose my thought now. Madam Speaker, so it was a known fact that the people that we gave loans in 2023, they experienced a drought. So where is the Ministry of Local Government expecting our people to get the money from to pay back when they experienced a drought? There is nowhere else where they will get the money. So where is the ministry expecting our people who got money to invest in farming? Where is the ministry, this minister and the ministry, expecting our people to get the money to pay back? Thank you, Madam Speaker.
Thank you. The Honorable Minister of Local Government and Rural Development.
Madam Speaker, thank you so much, and I would like to thank my dear colleague for a follow-up question. Madam Speaker, in Zambia, we have two types of farming. There is rain-fed and also winter. There is also another one, the third one, which is using the wetlands. So I wouldn't know where, the government wouldn't know where the resources went, whether they went on rain-fed or wetlands, because wetlands were there. In Sinazonga, Madam Speaker, we have farmers along the lake shores. They cultivate throughout the year. Even when there was drought in 2024, those along the wetlands, they harvested. So depending on how, luckily is also a leader. So when such a situation happens, we need information from the leaders themselves so that they inform the government on exactly what type of farming was undertaken by those who got loans. Then from there we can take it up. Thank you so much.
Thank you. The Honorable Member for Kwacha.
Thank you, Madam Speaker, and thank you, Honorable Minister, for responding to these questions concerning the affected people in Kabushi constituency. And it's good, Honorable Minister, that you have recognized that there is a problem in Kabushi with these affected people, and you have given them comfort that should anyone be visited or anything happen, they can seek redress either from your office or other offices. Honorable Minister, given that situation, don't you think there is it's important or it's proper that you issue some kind of a memo so that those people can be comforted that whatever that may take place in future, there will be something that is in writing and they'll be protected through that particular memo. Thank you, Madam Speaker.
Thank you. The Honorable Minister of Local Government and Rural Development.
Madam Speaker, thank you so much, and I'd like to thank my dear colleague for a follow-up question. Madam Speaker, let me put the record straight. I never said people those who got, they shouldn't pay. These are the matters that we need to study case by case. Was there those who utilize the resources, but they don't just want to pay? Those are different. But those that had a disaster, definitely the laid down procedure that I read through, Madam Speaker, if it was followed, that is 2023, not now, definitely something will happen. People will be considered. If they never followed the laid down procedure, we shall put everything as they don't just want to pay the loans. Thank you so much, Madam Speaker.
Thank you. The last one, the Honorable Member for Lukasha.
Madam Speaker, thank you for the opportunity to ask the Minister a follow-up question. Minister, I just wanted to reconfirm, one of the reasons why loans under CDF have not been very effective in terms of performance is the absence of the monitoring and evaluation process in the CDF guidelines. Is your ministry considering introducing an effective tool for monitoring and evaluation of the CDF loans on that base? Thank you, Madam Speaker.
Thank you. The Honorable Minister of Local Government and Rural Development.
Thank you so much, Madam Speaker, and I would like to thank the Member of Parliament for a follow-up question. Indeed, Madam Speaker, loans haven't performed very well when it comes to repayment, and those are the ideas that we are receiving, and we are taking it seriously, that such suggestions are brought on board as we embark on loan recovery and also the future loan disbursement. Thank you so much, Madam Speaker.
Thank you. The next question, the Honorable Member for Chinsali.
Yes, you have escorted me today. Thank you, Madam Speaker. Question number 211.
The Honorable Minister of Agriculture.
Thank you, Madam Speaker. Honorable Speaker, the member for Chinsali, Honorable Member for Chinsali, Mr. Mukosa, asks, A, what was the staff establishment for agriculture extension officers in Chinsali district as of October 2025? And B, how many officers there were as of the date above? C, whether the number of officers above was adequate to ensure optimal performance. And finally, D, if not, what additional officers will be provided to the district? Our responses, Madam Speaker, as follows. For A, the staff establishment for agriculture extension officers in Chinsali district as of October 2025 was 32. B, there were 32 officers as of the above date, broken down as 4 agricultural supervisors and 28 agriculture assistants who are the extension officers. C, the number of officers is insufficient to meet the demands of the district. It is not sufficient. And finally, the ministry has requested for Treasury Authority to recruit additional extension officers for the year 2026. Madam Speaker, I thank you.
Thank you. Supplementary questions. The Honorable Member for Chinsali.
Thank you, Madam Speaker. Madam Speaker, considering that the Minister has stated that the number of agricultural extension officers in Chinsali are not adequate, I would like to find out from the Honorable Minister, by what number are we short for us to reach a point where we can say that we are comfortable with the number of agricultural extension officers? I thank you, Madam Speaker.
Thank you. The Honorable Minister of Agriculture.
Thank you, Madam Speaker. According to the establishment for Chinsali, it's 32. We have 28. What we need is the difference, which I think is 4. However, I must mention, Madam Speaker, that globally, nationwide, the numbers for agriculture extension officers are still far short of what is required. We have put forward a request, and when authority will be given, we will be employing as permitted. I thank you.
Thank you. The Honorable Member for Chinsali.
Thank you, Madam Speaker. Now that the Minister has stated that we are short by 4 agricultural extension officers in Chinsali, so I would like to find out from the Minister what happens in the meantime. How is that shortfall covered for, considering that we don't have those numbers? And how is the extension services, how is the extension services affected in Chinsali, considering that we do not have adequate numbers? Thank you, Madam Speaker.
Thank you. The Honorable Minister of Agriculture.
Thank you, Madam Speaker. I think the bottom line is that the numbers are inadequate. That is a fact. However, we are giving our extension officers, Madam Speaker, we have given them tablets to work with. We give them toolkits to work with. And we are, as much as we can, giving them motorcycles so that they can reach out much more than they were. For the first time in more than 20 years or so, the ministry has bought quite a number of motorcycles which were given to these officers to make them more mobile and reach out further. I thank you.
Thank you. The next question, the Honorable Member for Chinsali.
Thank you, Madam Speaker. Question number 212.
Thank you. The Honorable Minister of Defense is going to handle the question virtually. The Honorable Minister of Defense, you have the floor. If you can unmute yourself, Honorable Minister, we can't hear you.
Thank you very much, Madam Speaker. The Honorable Member for Parliament for Chinsali asked the Honorable Minister of Defense the following question. A, how many of the categories of military officers were stationed in Chinsali district as of August 2025? That is the Zambia Army, the Zambia Air Force, and Zambia National Service. In B, the honorable member asks whether the government has any plans to construct housing units for the officers above. And in C, when the plans will be implemented. And finally, in D, if there are no such plans, why? Madam Speaker, our response is as follows. A, all the three services have presence of officers operating in the district. However, disclosing the number of personnel, military personnel, in the area might not necessarily be in our interest. And so, if you may, the Right Honorable Madam Speaker and the Honorable Member of Parliament for Chinsali, I will pass for security reasons. Under B, yes, government has plans to construct housing units for the officers as mentioned above. And under C, as the Member of Parliament may be aware, this is a strategic plan which will be implemented in phases. Building housing units for defense forces all over the country needs and requires a strategic plan detailing how we're actually year by year or phase by phase going to construct. And so that plan is available and will be implemented as funds are made available. And in that regard, Madam Speaker, D then is answered by C. I thank you.
Thank you very much, Honorable Minister. Supplementary questions, the Honorable Member for Chinsali.
Madam Speaker, thank you very much. I do understand the response by the Honorable Minister in part A of the question where he stated that giving the number may compromise the security. That is okay. Now on part B, as to when the government is planning to construct houses for men and women in uniform, that is the Zambia Army, Air Force, and the Zambia National Service. The answer that the minister has provided is a little bit vague and subjective, Madam Speaker. These people who are in Chinsali, Madam Speaker, I am their Member of Parliament, I speak for them. I am interested in knowing their welfare. I want all the military officers that are in Chinsali to have houses. They need to have where to stay, and the government should provide those houses, Madam Speaker. So I would like the minister to be very categorical to give me a position or to advise this House when exactly the ministry is going to implement the construction of houses for these very important men and women in uniform in Chinsali. Thank you, Madam Speaker.
Thank you. The Honorable Minister of Defense.
Thank you very much, Madam Speaker. And I would like to thank the Member of Parliament for Chinsali for that follow-up question. Very, very important, emotive, and I understand. I am at the receiving end. What the member of Chinsali requires and desires is exactly what the Ministry of Defense requires and desires for its personnel. I am being as objective as I can be, given the circumstances and the economic situation that this government is in. I do not want to go into history, and elaborate what went wrong and how we could have moved on and have had better resources to tackle some and many of the many problems that not only the defense ministry, but all ministries are facing. But suffice to say, this government seriously is taking this issue, this challenge seriously, and will make whatever resources are available within and without the Treasury, Central Treasury, to ensure that we build something for our men and women in uniform. However, it would be folly for me to just say tomorrow we are going to build because of the situation that exists. No, these things have to be planned. And that's exactly what this government is going to do in a methodical and properly outlaid manner. I would like to assure the defense forces, the men and women in uniform, that this strategic plan is underway and mobilization of resources is paramount in order for us to reach the desired objective. I thank you, Madam Speaker.
Thank you very much. The Honorable Member for Chinsali.
Thank you, Madam Speaker, and I have understood the answer that has been provided by the Honorable Minister. Madam Speaker, what obtains in Chinsali is that Chinsali is the newest provincial headquarter in this country, which is a provincial headquarter for the new Muchinga province. And what happens is that there is a shortage of houses as a result of, because of it having been declared as a provincial headquarter, there has been an influx of people moving to go and start working there because of new government offices and the private sector establishing their establishments there. So there is a very high demand for houses, and as a result, the prices of houses has gone up so much. So I would like to find out from the minister what current system is in place or what we are doing to ensure that our military officers, Zambia Army, Zambia National Service, and Zambia Air Force, and the military officers that are in Chinsali, what are we doing in the meantime to provide for them in terms of accommodation? Thank you, Madam Speaker.
Thank you. The Honorable Minister of Defense.
There are only two options, Honorable Member of Parliament there. Compete within the competitive field in terms of housing accommodation, and that the military is providing the necessary rentals. So we go out there, use our influence as much as possible, institutional influence, of course, to try and secure the necessary accommodation at competitive levels or within the competitive environment. That's one. The other basically is the normal provision of ad hoc arrangements by the Army or whichever service, Zambia National Service or Zambia Air Force. And these are temporal sort of ad hoc arrangements to ensure that before you go into a competitive environment where you can secure the necessary rentals or housing units, you are at least provided for. And unfortunately, that is the current situation until such a time that we allocate bit by bit some monies to ensure that some of these buildings are constructed. We have Zambia National Service, which has a builders brigade. We have ZAF also, and Zambia Army have a resemblance of the same. And these are the ones with the little resources that we can manage here and there, be able to give them for them to start building some of these housing units on a self-help basis, which reduces the number of the amount of, which reduces, the cost of construction, but at least is able to cater for our men and women in uniform. Those are the two options that we are pursuing, Madam Speaker. I thank you.
Thank you very much. Next question, the Honorable Member for Chilubi.
Thank you. 2-1-3.
Order. As the time is 16:40, I suspend business for 20 minutes for a health break.
Very much for watching Parliament television. The House has taken a 20 minutes health break, and just before the break, the House had just started considering question number 213 posed by Chilubi Member of Parliament, Mr. Mlenga Fube, and his question is directed to the Minister of Fisheries and Livestock, in which he wanted to know whether government has any plans to restock livestock in Chilubi district, and part B of the question, if so, when the plans will be implemented, and how many of the following will be restocked: chickens, goats, and fish, and what the estimated cost of the project is, and if there are no such plans, why. So this is where the business of the House has ended just before the break.
And just to mention, Pauline, that earlier on, Madam Speaker did make some announcements on the floor of the House, and there were 5 announcements to be specific, but of course we'll run you down those announcements. Pauline, the first announcement.
In the first announcement, the Honourable Madam Speaker did inform the House that she had received communication to the effect that in the absence of Her Honour, the Vice President, who is attending to other government business, the Minister of Finance and National Planning, Honourable Dr. Stumbeko Msokotwani MP, had been appointed to act as leader of government business in the House from today, Tuesday, 24th February, until further notice.
After that, there were some announcements in which Madam Speaker did recognize the presence of guests in the public gallery, but of course Pauline will run you through that later on. And then just to mention that after, welcoming the visitors that were in the gallery, Madam Speaker then made another announcement. This is when she informed the House that with immediate effect, any member who has been granted permission to attend sittings of the House virtually shall be required at the commencement of each sitting to stand while their camera is switched on during the singing of the national anthem. She said that the requirement is intended to uphold the dignity and decorum of the proceedings of the House, and also to ensure that all members, whether physically present or attending virtually, accord the national anthem the respect it duly commands. She hoped that honourable members would observe this directive accordingly.
Yes, Mota, and in welcoming the visitors to the National Assembly, the Honourable Madam Speaker welcomed 3 visitors, and this was Lift Up Academy School in Chivombo District, and also recognized the presence of pupils and teachers from Chainda Community School in Lusaka District, as well as 2 members of the public from Nkeyema District in Western Province. And on behalf of the National Assembly, she welcomed the visitors to the institution.
Okay, so after those announcements, there was an opportunity given to members of Parliament to indeed raise urgent matters without notice. So 3 matters were raised this afternoon. The first one was from Lunte, Member of Parliament, and this matter was directed at the Minister of Education. In his matter, he really just wanted to find out on the students for NOTEC who were paid to welcome or receive the President of the Republic of Zambia when he visited the Copper Belt. And indeed, the Honourable Minister of Education was given an opportunity to clarify that. So that was the first urgent matter without notice. The second matter was from Nakondo, Member of Parliament, directed at the Minister of Home Affairs and Internal Security. His matter was basically around the 16 members of Tonsoi Alliance who were arrested in a room when some UPND members who had a meeting in public were not arrested. So he wanted to find out, wanted clarity from the Minister of Home Affairs and Internal Security. However, Madam Speaker did say that this matter was inadmissible because for one of the obvious reasons, as we know, the standing order does provide that there's certain criteria that have to be met for urgent matters without notice to be, admitted. And the first one usually that we talk about is that it should happen within the last 24 hours. So this was one of the reasons that this matter was not admitted. And then the last matter that was raised by Dundumwezi, Member of Parliament, who directed his matter at the Minister of Agriculture. He just wanted to find out more from the Minister over the 400 kwaches that were deducted to enable farmers to qualify to the FISIP program. So I wanted to know whether the affected farmers will be refunded or given inputs. This matter, too, was inadmissible, but the Member of Parliament was advised by Madam Speaker to file in a question so that he gets more details. So those are the three urgent matters without notice that were raised on the floor of the House this afternoon.
Yes, Muta, after the urgent matters without notice, there was a ministerial statement that was rendered by the acting Minister of Health, and this was on the health issues of public concern. And in his ministerial statement, the minister began by updating the House on the confirmed detection of circulating vaccine-derived poliovirus type 2, CVD-PV2, from an environmental sample collected in Lusaka district. The minister also updated the House on the cholera situation and concluded with an update of the availability of medicines and medical supplies availability in the country and the measures that have been put in place to curb the pilferage of medicines and medical supplies in the public sector.
Okay, so that is some of the business that has taken place on the floor of the House from the time business commenced at 14:30 hours. But for now, we'll take a short break. We'll be back on the other side just to run down on more business that took place and what we expect the House to consider a little later. Enjoy watching Parliament TV.